Kia ora koutou katoa. Welcome again to the Ministry of Health. Thank you for sticking with us through the week, and it's nice to be getting to a Friday. Thank you also for including the sign language interpreter in your picture. I can start by telling you that there is no confirmed case of COVID-19 in New Zealand. And then move on. I'd like to move on to Diamond Princess folk who came back and arrived back in the country clock last night and have been at the Whangaparaoa reception centre since about 9 o'clock. This was the 6 New Zealanders who came back. The doctor and St John paramedic who were on board tell us that they were all well, or the people were all well right through the flight, and certainly there were no symptoms presented. And I'm also told they are all in good spirits today. They had a full check by a general practitioner, and none of them are displaying any symptoms of COVID-19. While they're here, each member of that group will be checked on a daily basis. And I do want to thank them very much for their willingness to come off the ship where they've been in quarantine for 14 days and quite a challenging environment there, and then being prepared to spend another 14 days in our facility up at Whangaparaoa. They all recognise the importance of that to protect their and their families' health, and also part of our broader public health response to protect the New Zealand community. I understand there's been a little bit of confusion about the number of Kiwis originally on board the Diamond Princess, so just to quickly cover that, there were originally 14 New Zealanders on board. 6 are now back in Whangaparaoa. 3 have opted to stay outside of New Zealand for that 14-day self-isolation period. One of those people actually is resident in Hong Kong and has returned there. And then there are 4 people being treated in hospital because they have tested positive for COVID-19. 2 of those people are accompanied by a non-symptomatic, non-positive family member who's also with them. So I hope the numbers there all add up. As I said yesterday, our Director of Public Health, Dr Caroline McElnay, has spoken with the original 2 patients who are in hospital in Japan. They've been in hospital for probably around 10 days now. They're stable, they are doing well. There's been some talk, I understand, that they may be able to leave hospital in the next few days, but nothing confirmed at this point. And the other 2 New Zealanders who had positive COVID-19 tests as they were preparing to leave Japan to come back to New Zealand are also in hospital. They are stable and well. There was some media interest this morning around observations made by the Association of Salaried Medical Specialists, the ASMS, around their concerns that if we do get a COVID-19 outbreak in New Zealand, it might coincide with the influenza sort of peak through winter. We know winter is when we do get a peak in flu in New Zealand, as happens in all countries. I should say that over the last 3 years, that winter peak has been much lower than it has been in prior years. And one of the key reasons for that is we have had increasing numbers of people being vaccinated with the influenza vaccine each season. Last year, we vaccinated more people than we had ever before. We brought in, or Pharmac brought in 1.36 million doses of vaccine. We've ordered for this year 1.46 million doses, so we've increased that by another 100,000, and we're actively talking with Pharmac about sourcing more. So, in addition to our health sector preparations, one of the key things we should do, and I'm going to give this a strong plug, one of the key things people can do is get an influenza vaccination this season. The vaccination will start to roll out from the beginning of April, and clearly the more people who are vaccinated, the less likely it is to circulate in the community, the less likely people are to become unwell and therefore require hospital care. So an unashamed plug for people to get a flu vaccine this year. As you'll know, in terms of the overall pandemic plan and the response phase we are in, we're still in that keep it out phase. And the border restrictions have been really important for us because it's given us time to see what is happening with this infection from both the epidemiology and the science. And of particular interest here is what happened on board the Diamond Princess cruise ship, which has only really evolved in the last week or two. And we've been able to see the high rates of infection in that sort of environment, which will give a lot of information about how contagious it is. And also, as the weeks go by and people recover and or some people may die as a result of that infection, it will inform the science greatly. So I know there is concern, and these have been discussed in a number of quarters. There are concerns from the universities about students who are unable to travel here. I acknowledge and share the fact that this is causing problems for them. However, what we are focusing on first and foremost here is protecting the public health of New Zealanders. And the fact that we have been able to remain free of the virus to date has given us several weeks in which to better understand how this infectious disease, this new infectious disease, is actually evolving, and that is very important for our overall efforts. 2 or 3 final comments. By today, so till midnight on the 19th of February, 8,487 people had travelled from or through China in the prior 14 days, so 8,487. 4,461 of those people will have completed their 14-day self-isolation. So more than half of the people who have come in from China since the 3rd of February have in fact completed that 14-day period. And another comment on that is we now have people at the airport registering travellers from China directly with Healthline to make it even easier. So every person coming in from China is filling out a card there and then that is then registering them with Healthline, so Healthline can follow up with them during that self-isolation period. My final comment is just there was a paper published in the New Zealand Medical Journal this morning. One of the authors, the co-authors, was Professor David Murdoch, an international expert in infectious disease, and just want to leave you with a quote he made, which I think is very appropriate for the situation we find ourselves in. And I quote, "This is a time when there are some pretty tough decisions to be made by public health authorities, and often there's no right or wrong. Everyone's working with the best available information, which is changing very rapidly." And I think that nicely describes the situation we are in, why we have taken a precautionary approach, and to date our measures have been successful in preventing us having a COVID-19 infection in this country, and of course we are now even better prepared to deal with an infection should we get one here. I'll finish there and I'm happy to take questions.
2 people on the flight from Japan to Darwin tested positive for the virus. What's the risk to other patients?
Are these 2 people who are in Australia? So the risk would be similar to when they were on the ship. In fact, arguably, the risk of transmission on the plane was lower because there were very strict precautions in place. So I imagine these people would have been harbouring or incubating the infection before they got on. They were not symptomatic and didn't test positive then, but have subsequently.
The Ministry of Health has said that it's likely we'll see a COVID-19 case in New Zealand eventually. Do you still stand by that?
I do, and we still think there's a high likelihood we will get a case. And of course, what we have been doing to date is putting in place measures designed to prevent that happening in the meantime.
Are you concerned that a COVID outbreak could happen at the same time as the flu season? I know you touched on that a little bit before, but what would that do to our hospital system?
Well, we know that there is this winter flu peak, and it's not just flu, it's a range of other respiratory illnesses that does put more pressure on the health system during winter. And that happens each year. If we also get a COVID-19 outbreak superimposed on that, that will add additional pressure. Remembering that most people who get COVID-19, and indeed most people who get influenza, don't end up in hospital. What we can do, what is absolutely within our control at the moment, is to vaccinate as many people as possible with the flu vaccine once it's available, and that will help enormously to reduce the impact of this year's winter flu season.
And do COVID-19 and the flu share symptoms?
They do very much. So the symptoms of influenza are fever, chills, rigors, feeling very unwell. It's not like having a cold. You know when you've got the flu. And likewise, we've seen the pattern of symptoms with COVID-19 is fever. So about 9 out of 10 people have fever, cough, difficulty breathing for people who have quite a severe infection, but also just reminding us, as the WHO has said, most people have mild to moderate symptoms. So it would be like a standard cold.
And this might cause quite a bit of worry among Kiwis. How can health officials prevent people worrying unnecessarily about what they may have?
Well, at the moment, if people have got symptoms of a respiratory infection, it's not likely to be COVID-19. It's likely to be something else. And in fact, you'll recall that we have been testing people with symptoms. The number, I think, off the top of my head is between 80 and 90 to date. None of those have tested positive for COVID-19. And those were people for whom there was some suspicion they potentially could have been exposed. So people with respiratory symptoms at the moment won't be having COVID-19. So saying, anyone in self-isolation who has come from China will, if they do have symptoms, should call Healthline and talk about those symptoms, and they will determine whether further investigation is needed.
Just in light of the 2 first deaths from people who are on board the Diamond Princess ship, have staff at Whangaparoa kind of rejigged their process for dealing with the 6 evacuees who arrived last night? Did that change, that information change the handling of those evacuees at all? Or?
Yes, so the infection control precautions are similar to the ones we had for the Wuhan evacuees. We had an infectious diseases specialist advise on what those precautions should be, and then we had infection prevention and control nurses take the staff through all the precautions and actually train them in how to put a mask on, how to use hand gel just to keep themselves safe, and also the returnees, the people who are there, the 6 people have had training and also those things as well. So the precautions are similar to what they were for the Wuhan evacuees.
Do you also have an update on the Western?
I've got a couple of notes here, so I'll just share those. So just an update, there are 13 New Zealanders who are back in the country who were on the Wester Dam. Healthline is in contact with all of those people. They are in self-isolation and none are showing any symptoms of COVID-19.
Those 2 Australians have tested positive. What does that mean for the New Zealanders that were on that plane? Do they need to be retested?
No, we'll just keep that. So there's the 6 people in Whangaparoa. They'll have daily checks. If there is any sense that they have any symptoms that could be suggestive of COVID-19, there will be a low bar for testing, as there was with the Wuhan evacuees.
What's the latest on the travel restrictions?
The New Zealand current travel restrictions. So those are due to expire midnight next Monday, and we're just in the process of putting further advice to Cabinet about decisions for any extension or lifting or continuing those current restrictions beyond midnight on Monday.
With the 4 Kiwis who are in hospital in Japan who have tested positive for coronavirus, you said the earlier 2 who were diagnosed may be released in the next few days. I mean, what kind of conversations are happening there with MFAT about their being brought back here? Will they be taken to a different facility? I know there was some talk of maybe opening a smaller place somewhere, or would they also be taken to Whangaparoa with the other 6, or what kind of, or somewhere completely different?
So those people will be discharged when the clinicians looking after them determine they're well. I have a strong suspicion they'll be tested before they leave. But those people, when they travel back to New Zealand, won't need to be put in any form of self-isolation or quarantine because they've had the infection. They're no longer infectious and they'll have their own individual immunity to it. So there's no requirement for that to happen. And I know Foreign Affairs officials are working closely with them to ensure that they've got travel arrangements in place when they want to come back.
And I think there was also yesterday some no family members or friends had met these 6 evacuees when they arrived at Whenuapai Air Base. Was that just because, does the ministry know anything about that? I mean, were people instructed not to come deliberately, or? Yeah.
Sure. The question I was asked yesterday was whether anyone was going to join them in a quarantine up in Whangaparoa. no one has been joined. But as with when the Wuhan evacuees came, no family members or friends were able to meet them at the airport. It was a very quick process to get them through immigration, primary industries clearance, the MPI clearance, and then on a bus up to Whangaparoa.
How has Whangaparoa changed in terms of the numbers, of staff who are there versus, I know there was a larger number of evacuees
Sure.
who were there previously. What kind of figures are there now? Yeah.
I don't know the exact numbers of staff, but clearly it's a much smaller operation. But we'll put that information up on our website about the sort of staff who are there and how many are there. Any other questions?
There are suspected cases in Fiji. What is New Zealand doing to help our Pacific neighbours about COVID-19?
So two things very deliberate things we're doing. One is that our responsibilities to the Pacific are in helping to inform our border measures here, because clearly New Zealand is a really key jumping off point for the Pacific, and we feel a strong sense of responsibility to prevent COVID-19 getting to Pacific countries. The second thing is that Ministry of Foreign Affairs and Trade have been part of discussions right from the early days with the WHO, the Secretariat for the Pacific Community, and Pacific countries about what support they need. And in particular, we're in very close contact with the countries of the realm, so Cook Islands, Niue, and the Tokelau Islands, but also Samoa and Tonga and Fiji. So we're working very closely with them, and our missions there, our foreign affairs staff there are in very close contact with the governments and feeding information back to us, including about any support they might need.
If it does get there, can Pacific countries cope with an outbreak like this?
It would be much more challenging for countries with a less health infrastructure than we have in New Zealand. And very early on, when the WHO declared this a FEC, a public health emergency of international concern, they specifically talked about the impact an outbreak like this has on low-income countries, low and middle-income countries with less well-developed healthcare systems. And so that's a very strong reason for why we want to be both preventing the infection getting to the Pacific, but also supporting their planning and response.
Is Healthline just making its way through those last few people who still haven't been contacted? There was no figure available yesterday.
Yes, continued efforts. And again, I don't have the exact number, but now that we're registering people as they come in through the airport, that will of course make it easier for people who are going into self-isolation to register as they arrive in New Zealand. If there are no other questions, thank you very much. Enjoy the rest of the day, and we will see you again. Kia ora koutou.